I had back pain that resulted in herniated disc both in my lumbar region as well as my cervical area. I had surgery, and the lumbar surgery removed the pain. So they fixed the herniation. For some reason, I still had the pain after the C4, C5 surgery, and it went on for a few months. The orthopedic surgeon who performed that and worked with me had put me on pain medication.
I was fused between C5 and C7, and that brought back the use of my hand, but it didn't cure the pain. The pain was better after the surgery, but then it progressively got back to where it was before. It just progressively got worse and worse. My wife took me away from dentistry on December 5th before the surgery, said you can't practice anymore, because I was just so bad.
They didn't find a solution after many, many different trials of epidurals and so forth to reduce the pain. So they referred me to Dr. Lipov.
The best patients that we would like to see is people who had failed neck surgery. So they had neck surgery, they have persistent neck pain but no arm pain. They've tried every modality known to mankind and all failed. Also, if people had persistent neck pain but they're not a surgical candidate for whatever the reason, and they're a good candidate to do something else, we would love to see those type of patients, because we believe the success rate in that type of population potentially is 60 to 80%, and they're a very difficult group to treat in general. I have treated them for years, so I know what type of group it is. Nerve stimulators, basically what's done is electrodes are being placed in the body, and then the idea is to send electrical current into the brain to turn off the pain. The advantage of that is there is no drugs being used, and if it works, all you have to do is change the battery every 7 to 10 years. When you're doing stimulators, you do a trial first. You put an implant in, just placing through a needle, so there's no incisions made, and then the patients go home, they try it out. So when you do a trial, if it works, then we do the same thing only permanently. Then we make a couple incisions, and when we put electrodes in the right area and connect it to a battery source, that needs to be replaced every 7 to 10 years.
The electric buzz replaced the pain. And so with that, what happened to me was that I could function, and by turning it on, and even at fairly high levels, I can still function in terms of not having to worry about the pain. I thought, wow, this is a whole lot better than taking drugs.
I couldn't believe how great Dr. Kraemer looks. He looks so amazing. He looks like a different person. When he walked in, he was so friendly. Normally he's a little crabby because he's in pain. He was happy to be here and just came in and started right to work.
I'm at the end of my day, and I feel about the same way that I started this morning. It was funny, I didn't feel any pain at all after surgery. It was like I never even had surgery. It'll be a slow weaning off the pain meds, but I can tell already that I can do it. I jumped down half the amount the day after surgery.
Sub-Q stimulators, there is pretty much no downside. Possible infection under the skin, which is easy to treat, or possible bleeding under the skin. Again, very easy to treat.
I'm going to get the permanent device installed within 2 weeks, so that'll be nice.
Within maybe 120 days in total, I didn't need it anymore. The pain was actually there, and then it was gone. I've never turned it on since. It's been since 2007 sometime, and it's now 5 years later, 4 years later. I'd come back again 5 years from now. It was that critically important to my life and my results.
It brings your life back. It gives you your life back.
If somebody out there has pain and the hopelessness of pain, they should call Dr. Lipov. Simple as that.